Hi, my name is Dr. Jake Dodds. I'm a chiropractor at Spark Wellness in Fairhope, Alabama. And in this video, I'm introducing this idea of the relationship between a misalignment of the upper cervical spine and migraine headaches. So if you haven't heard of the term upper cervical before, cervical is simply in relation to the neck. It's like a fancy medical term for neck. So anytime you hear cervical spine, cervical area, they're literally just talking about the neck. Now, what happens to a lot of people is that wear and tear, accidents and injuries throughout the course of a lifetime, there can be a misalignment between how the skull is sitting on top of the neck. Ideally, it's in a nice straight line. Ideally, we're not getting this big forward or backward. Ideally, we're not getting like a big tilt one side to the other. And you'd be surprised how many people are walking around on a day-to-day basis with significant misalignments between their head and their neck. Now, when that happens, a bunch of different things happen simultaneously and they can all feed into this picture of migraine headaches. So the first thing is, head weighs 15 to 20 pounds, and if it's not sitting in the correct position, your muscles have to start doing a job they were never designed to do, which is keep everything in a stable position and try to keep everything upright and try to hold up the weight of the heavy head. So if everything's stacked up appropriately, the bones take care of that work. The more we start shifting around, the more the muscles have to do. So not only does this make the muscles tired, they usually get pretty sore and sensitive, and then ultimately what it does is they get so tight that it restricts the movement, which creates problems on its own. So again, just from a very purely mechanical perspective, the more twisting and turning we have, the more those muscles are going to be irritated, and when we're talking about tension, we obviously know that's something that's part of the migraine headache equation. The second thing that happens if the head's not sitting correctly on top of the neck is the nerves start to get irritated. So we have the nerves that are actually running in the spinal cord, which runs directly through all the bones in the neck. So again, if we have twisting, turning, and leaning, the spinal cord itself can start to have torsion to it, particularly at the upper cervical part where the brainstem connects the brain to the spinal cord. So right there we have the top bone in the neck called the atlas, and that really has a lot of movement, which allows us to move our head freely, but it also leads to a higher probability of a misalignment in a bunch of different directions. So if that's sitting in a torqued position, there can be inflammation, there can be stagnation of fluid flow to and from the brain, and we really want to make sure, obviously, that when we're talking about the nerves that control the entire body, that we're not dealing with a misalignment on a consistent basis. A similar story, there's nerves that run out in between the bones of the neck, some of them come back up into the head. So nerves are pretty sensitive and they really require that nice open spacing in between the bones to work effectively. The more everything gets compressed and closed down, the more the nerves get irritated as well. Another thing that happens is fluid flow. You have something called cerebrospinal fluid, which covers your entire brain, it covers your entire spinal cord, and it's kind of like the blood for your central nervous system. So it delivers nutrients, it takes away waste, but that flow is super important. If it can't go to and from where it needs to go, it starts to stagnate, and what they're finding is that can cause protein backup, it can create an inflammatory process, and it's not something you want. So in terms of your body's ability to regulate itself and deliver nutrients to these vital structures, that cerebrospinal fluid is also dependent on things being in the correct position. If you got a hose and it's kinked, the water doesn't flow correctly. It's no different for the cerebrospinal fluid. The other thing that comes into that conversation is the blood flow. So in the top bone in the neck, you have these little holes that big arteries and veins are running through. And again, this is supplying the blood to and from the brain. So if we start getting compressed, blood's not flowing like it should, we're not getting the correct input and outtake. And again, the brain and the nervous system is the most metabolically active tissue in your entire body. So if it's not getting the nutrients that it needs and then we're not able to remove waste like we need to, things can go south pretty quickly, and migraine headaches is one of the things that can come into that equation. So if you've never heard this idea before, I highly recommend that you have somebody take a look at your structure. So there's people that do this on a consistent basis, and within chiropractic, there's a whole group of techniques called upper cervical techniques. The one that we practice in our office is called NUCCA, which is N-U-C-C-A. If you look in the description, there's a link to the NUCCA organization's website, and you can learn some more there if you like to. But the whole idea behind upper cervical chiropractic is a very detailed analysis and evaluation of how the head's sitting on top of the neck, and then a gentle approach of how to get back into a better position so it's not something your body's fighting on a consistent basis. So again, as you're continuing to learn more about migraine headaches, as you're continuing to dig for that answer, Make sure you keep the structure of the head and the neck front and center for yourself, and make sure that's not something your body's dealing with on an ongoing basis.